Well, if you have dealt with years of pain from a bunion, you know how bothersome it can be and the daily negative effects that come with it, and even the effects years and years later, right? There are now bunionectomy trials available to evaluate new pain meds, and you may be able to be part of them. Here with more on how people can qualify to get their bunions removed at no cost, we have Dr. David Lehman, president of HD Research, joining us today. Great to see you, doctor. Thanks so much for being here.
Thanks for having me.
Let's first chat about HD Research. Let's tell our viewers, what exactly is this? What are you guys doing?
So HD Research is a clinical research group, and what we do is we evaluate new therapeutics for primarily the treatment of pain, and a lot of the work is done for pain after surgery.
And this particular one that we're talking about today is about the dreaded bunion. And let's just bring everybody up to date. The bunion, of course, is the knot on the foot. And to remove it, it's called a bunionectomy. How simple is that type of surgery?
Yeah, so the bunionectomy is a surgical model we commonly use to evaluate patients after surgery. What happens is you see that joint there, there's whereas it moves out, there's a nerve that runs along that joint. It's quite painful. So what we do is we take off the bone and fix the joint so it's straight in line like it was prior to the surgery. In the process of doing that, which is a minor outpatient surgery, there is discomfort after surgery. So we use that discomfort after the surgery and that pain to evaluate new therapeutics, whether it's injectable drugs or intravenous medications or oral medications. We use that few days of pain that is going to come after surgery to evaluate whether or not these new therapies are actually acting as we hope they will.
And it's so interesting because when you're talking about a bunion, I mean, it's not like it's here one day and gone the next, or you buy something on the internet to remove it. It has to be surgically removed, and as years go by, that bunion gets bigger, gets more painful. So to remove it is basically the best option. And let's talk about the requirement, basically, for the days in house for surgery after. What are we looking at here?
Yeah, so typically patients will come in. They'll stay for a few days, sometimes a little bit more depending on the therapeutic that we're testing. It may be up to 5 days or even 7 days, but typically it's around 3 days. And they come in, they have a procedure. We have a really nice unit that they stay in. They're taken care of. There's a lot of people watching them just to make sure that they're doing well, and we're capturing all the data for their time spent there. You may ask this, but the patients, as you said, this is a no-cost surgery, and as well, they're compensated for their time as they come to their visits, as well as for participating in the study. And then, one of the large benefits that we have, really the largest, is that you're doing something that's going to help other people down the road once they have their surgery. We'll have newer and better pain modalities to treat their pain, so they don't have so much discomfort, and we can cut down on whatever oral meds they have to take at home.
That is such an important part of that, Dr. Lehman, too. And I know that you covered this, but if the patient, the benefits here is that the patient gets the bunion removed at no cost and paid for their time and for their travel. Real quickly, we've got about 20 seconds left. Who may qualify for this study?
Well, definitely people with bunions. That's the first step. You can come in and we'll evaluate you for that. Since we have a few seconds, we do other therapeutic modalities. We do total knees at no cost, and we do other therapies such as hernia repairs. It's a wide gamut of things that we do. So you can go to, for this, you can go to removemybunion.com or 281-801-5040. Is the number you can call to get hooked up with the studies.
Dr. David Lehman with HD Research, president of the group. Thank you so much for being here and sharing the information. Again, adults 18 and older to qualify for this as well. And for more information to see if you can qualify for this research study for the bunionectomy, visit removemybunion.com or give them a call. There's that number once again on the screen, 281-801-5040.